Hi, everyone. Today we're here with Dr. Sarah from BB Dental Studio. Dr. Sarah, thanks for being here.
Thank you so much for having me. I'm so thankful for the opportunity to be able to tell a little bit more about my dental office. So, BB Dental Studio, have only been open around 9 months now. I graduated dental school about 7 years ago. And then, throughout working for many other offices, um, I decided to just open up my own to be able to provide the kind of services that I want to provide to my patients. And I'm so glad that I did.
Yeah, so something a little bit unique about BB Dental is that you really provide like a concierge service to your patients. Can you tell me a little bit more about that and kind of your philosophy behind it?
Yeah, absolutely. So it's very personal. We really take care of it's so cliche and it's so kind of annoying. I get annoyed with myself when I say it so many times, but we treat everybody like they're our friends and family. We just high integrity, high quality of dental care, but at the same time, it's pretty reasonably priced, and we do accept most insurances. And I think that that makes it kind of like the ultimate dental experience. It's very gentle, very honest. Um, like I said, high quality of care, but at the same time, it doesn't have to break the bank. And in providing these services, we've been seeing so many happy patients that we're so thankful for. So they keep sending us more people, and it's like the best business model that there is because it's I'm doing what I love to do, the way that I love to do it, and then at the end everybody is happy.
I
Yeah.
love that. So, with cosmetic dentistry treatments, what are some of the different treatments and how do you know what treatment is really right for you? Because, when people are getting married or they are having their big life events, everybody wants to look their best, right? So, your smile is going to be plastered all over all your pictures. So, when you're really looking into cosmetic dentistry, what procedures are there? And again, how do you know which ones are right for you?
Yeah. A smile is so, so important. I don't know if you guys have seen like the picture with the person missing an eyebrow and then he's missing a tooth, and then you immediately go to the missing tooth. So your smile is so important. You can only Photoshop so many of your wedding pictures to make it look how you want it to look. But in terms of cosmetic procedures, they are there's like an array of them, right? So there are the ones that are more involved, I would say, which are like veneers, which where we can actually change the shape and the shade of the tooth all in one, um, and give you basically a brand new Hollywood smile in about a few hours, a couple weeks apart. We design the smile, we shape the teeth in a way that's very, very conservative, but still involved. Um, and then like a layer of porcelain goes over the teeth, and basically they look incredible. They look so brand new and beautiful. And we work with the best labs because the lab that you work with in terms of veneers is super important. But then there are other things that are a lot more conservative, and we don't have to touch the teeth at all. We don't have to change the structure of the tooth, the structure of the enamel at all, like Invisalign, which corrects the position of the teeth.
Mhm.
And it's not only cosmetic Invisalign, it actually makes your bite a lot healthier. It helps prevent like chipping and wear of the teeth. It protects your teeth as well. And our Invisalign package has like a free whitening kit that comes with it. So you get to whiten and straighten your teeth at the same time. So that's the one thing that I will like if somebody comes to me and asks for something cosmetic and the position of the teeth is not correct, that's the one thing that I will say will give you very, very good results, long lasting results, with being very, very conservative
Mhm.
to we don't touch the teeth at all. And then besides that, there are the white fillings and the white bondings that we do over the teeth. Those don't last very long, but they are very conservative. Um, but for these to work, the position of the teeth has to be correct. Anyway, but besides that, there's of course like professional whitening and like the whitening trays and the whitening kits, and that would all kind of fall into the array of cosmetic dentistry.
I
If
love
there's like
that.
a dental lecture.
So, if someone was thinking about these things, would you say are kind of like the most average timelines on it? How far in advance would someone need to come in, have to start some of the procedures?
Um, I would say, of course, the sooner the better. If you give us between like 6 months to a year for Invisalign, we can definitely strain your teeth in that time frame, depending on the case. But most cases, I do finish them between 6 to 8 months, and then the whitening would happen at the same time. So that's kind of a very good like procedure that we can do. But in terms of other procedures like whitening, just a simple whitening, like a professional whitening, that can happen just a couple of weeks. Doing veneers on your teeth, that can happen as little as a month. So all of it just takes a little bit of planning, but you can't really do it very last minute because we want to check the bite, check the shade, make sure that everything is comfortable for you.
Mhm.
Yeah,
I
that's kind of.
I did not realize that Invisalign could be that quick. I mean, I feel like that's probably one of the myths out there is that Invisalign takes longer than like traditional braces. So I that's a
Yeah.
big shock for me.
I definitely do not take as long longer than professional braces. Absolutely not. Yeah.
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 So what would a patient expect from like their consultation when they come in? How, like, kind of walk us through that process. When they're coming in, they're like, I want to do this, but I really don't know what I want, but I know I want to look the best for my big day.
Yeah. So I'll go over like basically like a new patient exam, consultation, all of these things. First of all, we make it as easy as possible to make an appointment. If you go on our website, you can request an appointment time that works for you, and we'll review it, approve it, and then get you in. And then we send you like new patient forms, and everything is very digital, very convenient, very just straightforward. And then you come in, of course, we welcome you in. If you have any concerns or questions, we go over them ahead of time. And then we'll take a full set of x rays, meaning x rays of every tooth that there is, just to make sure that the teeth are healthy. We also take a 3D digital tooth scan of your teeth. So the cool thing about that is that you actually get to see whatever I see in your mouth. And it's pretty incredible the technology that it's come to. We don't even have to take the putty impressions, the ones that make you gag. I haven't taken one, in almost a year now. So it's so cool. And then we go over basically all the different options. I will never ever decide something for you. I will simply educate you on all the different options and what we can do to make your teeth, first of all, healthy, second of all, look amazing. So after that, we can go over the treatment plan, of course, the cost of it. We go over all of that up front. We do offer payment plans as well. Um, all of that would be discussed on that first consultation, new patient visit. Yeah.
That's awesome. So I know that, including myself, many of the population have dental fears and anxieties. And I think it's like 36% in the United States has some dental fears. What are some of the things that you do to help calm patients' nerves, especially like I know my husband, he hates going to the dentist. Like it's one of his biggest fears. I have some fear when it comes to dental procedures, and I know that you do some pretty great things to help patients.
Yeah. So honestly, if you asked me the same question 9 months ago, my answer would be different. I would tell you, oh, we have like a comfort menu with essential oils and we have nitrous and I can give you a Valium ahead of time. And, we do have things like that can help like lower the anxiety.
Mhm.
But now after being here for 9 months and having my assistant Natalie here with me, and seeing how many patients we've literally changed their minds. Like I encourage everybody to go look at our Google reviews and how many patients we've actually helped with dental anxiety, and they come here and they're like, "Oh, I'm not scared anymore. You guys make me feel at ease." So I, I don't know. I've developed this confidence in me that no matter the anxiety is, I can help with it. And I don't know exactly what I do to help, but it seems to be working. So I'm just going to keep doing what I'm doing. But also, we do have a comfort menu that's fully complimentary. Um, we have like essential oils, a blanket, noise canceling headphones. You get to like watch Netflix in the ceiling as a distraction. All of these things help, but it's just what we do. It's like just being very honest, very gentle, also very quick. Like, you come in here for a procedure. Nobody wants to be here sitting for hours. Like, while I go from one room to the other room, go from one room, I get you numb, and then I go see another patient. This is not really how it works here. I actually really hate that. And that, I think, that makes anxiety even more. Um, but yeah, I encourage anybody with dental anxiety to give us a chance, and you'll see what we're about.
Yeah. I
Yeah.
mean, I feel like as soon as you walk into your office, it's automatically a calming presence.
Yeah.
It's very, serene area. You feel like you're walking into a spa. You don't feel like you're walking into the typical dental
That's so
office.
sweet. Thank you.
Absolutely. Um, so can patients do to keep their smiles what can patients do to keep their smiles looking the best after they've had their procedures?
Maintenance. So, coming to get a cleaning and a checkup done every 6 months is crucial to basically making it look as nice as possible. Some patients, they come here with like so much teeth staining because they haven't had a cleaning done. And I always joke with them, I'm like, you're gonna get like full whitening today because it's just gonna look so much whiter immediately. So keeping track with these 6 month appointments is very important. Also, just brushing and flossing at home, using a water pick as an additional modality to kind of keep your teeth clean. That's also very, very important. Everybody should floss at least twice a day, should brush at least twice a day, and floss at least once. You can keep those like little floss picks in the car, keep them by your couch while you're watching TV. Just you have to do it. It's not optional, non-negotiable. And I will be your biggest advocate to tell you every time you come in that you just have to do it. But I won't shame you for not doing it. I'll just push you, give you a little push. Yeah.
Yeah, I love that. Okay, so my favorite questions. What advice do you have for engaged couples while they're planning their weddings?
In terms of like dental or just anything.
Anything.
Yeah. Um, I would say like when you're in the middle of planning a wedding, it's so stressful. And mainly the stress comes from the cost of everything. And when we were planning our wedding, it was like I couldn't even enjoy it because of how much money you have to pay. Um, and it was just very, very stressful. And then the day comes and you've paid the money anyway. So you end up having fun regardless. So what I wish I had done is just enjoyed the moment regardless of the financial stress that it puts on you. Does that make sense? It's like you're gonna do it anyway, so you might as well just do it as with as little stress as possible and just try to find like good deals here and there. But yeah, I just wish I wasn't as stressed out as I was. So enjoy the moment, enjoy the planning. It's fun. You'll miss it afterwards. The wedding blues are real.
Mhm.
Yeah. Yeah, for sure.
No one talks about the wedding blues.
The wedding blues are so real. It's like everybody like gathers on one night and then they have so much fun and then they all leave you afterwards and they're like, okay, we're done.
And what advice do you have for couples just in general?
Um, I would say give each other grace, and communication is pretty hard. Just hang in there. It's like, I do believe that marriage is a lot of work and a lot of devotion to each other and a lot of compromise. And at the end of the day, it is absolutely worth it. You've made a commitment to each other. And I would just say, give each other grace and communicate and speak your mind and just, yeah.
So, obviously, like everybody wants to have a beautiful smile, but definitely need to do some dental health work as well, right? So, what are some of the most common reasons cavities happen?
Yeah, so that's such a great question because when I was younger, like I would always get cavities and I would go back to the dentist and say like, "Hey, like I'm brushing, I'm flossing. What more can I do? I'm not eating sugar all day long." And nobody really had explained it to me until I went to dental school, obviously, and learned all about it. But getting a cavity depends on a multitude of different things. It depends on your genetics, the structure of the actual tooth that you have, whether or not you've had fluoridated water as a kid, the type of saliva that you have, like how much saliva you actually have. And of course, your diet and your oral hygiene. Those are the two things that we can really control. Your diet and your oral hygiene. You can't really have foods that are really sticky.
Mhm.
I always joke, I'm like carrots and cucumbers will never stick to your teeth. They really don't really have a big chance of giving you a cavity. Where like crackers and other things and chips, those things really get stuck to the teeth and they turn into sugar and then they give you cavities. So focus on the two things that you can control, which are oral hygiene and diet. Yeah.
I love that.
Yeah.
Yeah, my husband actually has never had a cavity
Yeah. You
ever.
see, it's genetics. Yeah. He's very, yeah, very, very
He's very
lucky.
lucky.
Very lucky. Yeah. Very lucky. So, when patients don't have any cavities and they're just born with really, really strong teeth, I always tell them two things. You're very lucky. Come for every 6 months to keep your teeth nice and clean and sturdy so you can have them throughout. And then I tell them, like, have a lot of kids. So hopefully they'll get your genes too because they'll be lucky too. Yeah.
That's so funny.
Yeah.
What products would you recommend to keep everyone's teeth healthy and beautiful?
So, I would definitely recommend a soft toothbrush over a hard one. And if somebody has like dexterity, like somebody that's older or a little kid that doesn't have the dexterity that's needed to actually brush with a regular brush, then I would recommend an electric toothbrush. Um, and those ones kind of vary. There are like a multitude of different ones, but the best ones I would say are probably the most technology are like the Oral B ones. They're very expensive. They sell them at Costco in a pair.
Mhm.
Um, but they are the ones that really, really clean. In terms of floss, I would definitely recommend if you can handle it, which you kind of gotta work your way up to it, is the floss that's a little bit more gritty. They have a brand of floss, it's called Cocoa Floss, and that floss is very gritty and it kind of really grabs onto the bacteria that's sitting in between the teeth. Um, but more than anything, just floss with whatever floss is comfortable for you. And then the more that you floss, the more you'll realize the different kinds. And then when it comes to toothpaste, all that I would recommend is toothpaste that has fluoride in it. And I know some people, I mean, the minority of people, I would say, don't really like that. And if that's the case, that's totally okay. As long as you're brushing with something that is not very abrasive on your teeth, not like baking soda, not like those charcoal toothpaste that have like gritty pieces in them. Those actually can wear down your enamel and make you more susceptible to getting cavities because we want to keep the enamel strong and intact. That way it protects the inner softer layer of the tooth.
So, speaking of toothpaste, do whitening toothpaste really work?
They do if you use them. It depends on the case, but they do if you use them consistently. The only thing that as a side effect of using them like so much is sometimes they cause more sensitivity on the teeth rather than actually whitening. So the risks to benefits or the side effects to benefits is sometimes a little bit. mm. But the whitening toothpaste that I would recommend is the one by Sensodyne. Yeah.
And what about like the teeth whitening strips? What are your thoughts on like at home teeth whitening, over the counter strips that people get in the store? Do they work or
They work. Some people really like them and some people don't.
Mhm.
So I would say try them out, see if they work for you, and if they do, then that's great. But if the other option that I would say that's even better is if you come into the office and then I can make you trays that actually hold your teeth in place so your teeth are not shifting, because teeth are always going to move. As we age, it's kind of like getting wrinkles. Your teeth are always going to be moving and shifting forward and crowding. So if you come here, then I will give you those trays that will keep your teeth in place, but also you can use them as whitening trays, which are a lot better than the strips, a lot more comfortable, and a lot more effective. Does
Totally
that make
makes
sense?
sense. I've also heard that if you use the strips too long, it can cause teeth sensitivity
Oh,
as well.
absolutely. Yeah, absolutely. 100%. Yeah. So you kind of got to gauge with how much you want to use them, how old are you, if you know, and also the strips don't work on, well, whitening in general doesn't work if you have a crown or if you have like any kind of porcelain on your teeth, then it doesn't work on the porcelain, it just works on your natural teeth. So it's always good to go in for an exam and actually discuss that with a doctor, because I might tell you, I'm like, oh, there's no point of doing the whitening because your front tooth that has a crown on it, or it's not going to match the rest of your teeth. So there can be a little bit of planning there. Yeah.
So on to the whitening. I have to know, what are the worst things that stain your teeth?
Oh my goodness. The worst things is definitely like coffee, red wine, anything with color. Tea, black tea is not good. Um, like even beets, and anything literally with color in it. Like I'm trying to think. I'm like all the curries, those all like really stain your teeth. Anything with color definitely stains your teeth. So whenever we do whitening, we recommend a white diet. So like cauliflower, potatoes, chicken, all of those things are not gonna stain your teeth as much as the other things. At least in the beginning, while your teeth are nice and fresh and white, because the pores of the teeth are, a little bit open, and we don't want whatever color to go back in there and undo all the good work that we've done. Yeah.
Wow, I did not realize that there were so many more foods that can really stain your teeth too.
Yeah.
Wow.
Yeah. But I mean, I'm not going to tell anybody stop drinking coffee.
I hope not.
I will not be that person.
Do you have any recommendations for someone who does like enjoy a colorful diet on what to do to keep, maybe prevent their teeth from staining?
Yeah, I would just recommend drinking water like afterwards. You can like chase your red wine with water. That way it's not like sitting on your teeth. Um that's what I would just recommend, like take a sip of wine and then a sip of water.
You'll stay very hydrated. That's
Very
for sure.
hydrated. You won't get a headache the next day. That's
love
for
that.
sure. And your teeth will stay whiter.
I love that. Okay, anything else you want to remind anyone about?
I will remind everybody that we are accepting new patients and we'll take very, very good care of you. And we are in network with all the PPO insurances that there are.
I love that. So thank you so much, Dr. Sarah. Again, Dr. Sarah from BB Dental Studio here in Roseville. If you have any type of dental anxiety or just are looking for a new fun doctor, I recommend you come see Dr. Sarah here at BB Dental. Thank you.
Thank you so much.
Dr. Sarah, show us around the office.
Yeah, welcome to BB Dental. This is our little lobby area, which we love. Everybody loves this area. And then I will take you over our front desk. We have a little restroom there. And then this is our consult room. You know how like sometimes at a dental office, like they scream like your treatment plan in front of everybody, and they tell you how much everything is gonna cost in front of everybody, and it's like you can't really make a decision. So we created like a private room for that.
I love that.
Right? I that's always bothered me.
I love the consultation room. So you kind of can show like the different plans and how.
Yeah. It's just more private instead of like everybody kind of knowing your business.
Yes.
And this is our first treatment room one. And then I wanted to show you this the screen in the ceiling.
Oh, that's awesome.
Yeah, so you can watch like Netflix, Disney Plus for kids, Hulu, HBO. What else do we have? Yeah, all of those.
I love it.
Yeah, and we have noise canceling headphones too.
Okay, so right away you see this big big screen. What exactly is going on during a procedure on that screen?
Basically we show you all of your x-rays, your scan, pictures of your teeth. You know, if like I find something very specific, I go ahead and snap a picture and I put it on the screen so you can see exactly what I'm seeing.
I love it. So it's clear transparency.
Very, very, very. Yeah.
Awesome.
We try as much as we can. These are our goodie bags. So
love
like
it.
when you come in for a cleaning, you get a little goodie bag. It's like good for travel. Toothbrush. I'll take all of this out. Toothpaste. And then like floss and then a little mouthwash.
Oh, and look at your face. Little pics. So
Yeah.
You're saying take everywhere with you.
Yeah, take
so you can
everywhere
floss
with you.
anytime.
Yeah.
That's awesome. So it's a little perfect little travel pack.
Yeah. For summer. And then this is our second room, which is basically like the same exact thing as the first one.
Mm-hmm.
It's like superimposed over it.
Yeah, I love it.
Yeah. And then this room is the biggest one that we have. It's like everybody's favorite room. It's
This is like the deluxe suite, huh?
The deluxe suite. Penthouse. But yeah, this is everybody's favorite room.
And you get the gorgeous view of the green belt.
Yeah,
Yep.
yeah. We do have another room, but I didn't buy a chair in it yet. And when we get busier, I'll be able to add some more.
Yeah.
Yeah.
I love it.
Yeah.
Thank you for the tour.
Of course. Thank you so much. Thank you for being here.
Absolutely.
Yeah.